I appreciate the opportunity to speak here at this year's G20 meeting. Together, the G20 nations share about 50% of the global burden of TB and an even greater percentage of the opportunity, and I would add, the responsibility to fight TB globally. The premise of my presentation is that the G20 is uniquely suited to shape and scale transformational, data-driven digital solutions in their countries and to ensure that these solutions are made available to the rest of the world. Let me start with some context. It's easy to forget that 2019 was a golden year in which new tools and increased financial commitments showed that TB was solvable. A comprehensive assessment by a Lancet commission again showed that the diagnosis and treatment of TB was the most cost-effective intervention of all diseases studied. $1 invested in TB returns $24 of benefit. Achieving these returns on investments had become even more likely because the TB community was beginning to embrace the use of better data and pilot a variety of digital tools to improve the quality and the cost effectiveness of TB care. For example, the use of AI to read chest x-rays and identify TB was shown to greatly improve screening and triage. Evaluations by Stop TB partnerships and others had shown that AI can outperform radiologists. And based on this evidence, the WHO recommended automated radiography for TB screening and triage. The ability to digitally connect molecular diagnostic instruments with software like Aspect and data to care was shown to better link diagnosis to care and in the process speed up testing, decrease stockouts, and increase trust between laboratories and programs. Mobile apps were developed to help frontline workers and empower communities. For example, Demagi's ComCare allowed local developers to quickly build custom mobile software that improved the quality and efficiency of their frontline workers. One impact developed by the Stop TB partnership, Dure Technology, and the TB community had an app that collects, analyzes, and acts in real time to identify and remove barriers to accessing TB care. Digital adherence technology was introduced to help patients take their medicines. Importantly, technology such as that of WisePill and providers of video observed therapy also helped to foster a global shift in the mindset of TB control programs towards a more patient-centric model of care. TB Reach showed digital adherence technology to be feasible, acceptable, and impactful. TB control programs began to use digital approaches to integrate and improve service delivery. For example, Everwell Health Solutions supported India's national TB program to develop, deploy, and scale a national data system by enabling real-time dashboards, integrating government payments with patients' banks, and making all of this part of both public and private healthcare provisions. NICSHE improved the timeliness of national data from months to minutes. But sadly, today, just a few years later, global TB care and control is in the midst of a crisis. COVID has had devastating effects on every aspect of global health, but TB services have been disproportionately impacted. In the past 2 years, the number of undiagnosed and untreated cases has skyrocketed, and for the first time in a decade, TB mortality has increased. But I believe that in the right perspective, crises are opportunities in disguise. The silver lining of COVID is that in their response to it, the G20 showed how quickly a health system can muster a response to a health threat if they embrace the power of digital data and health. Central to the COVID response was the use of digital tools like Health Connect from Precout that enabled the early detection, mapping, and management of patient care while increasing patient empowerment with tools for triage and diagnosis. Together, these digital systems enabled better resource allocation, patient care, contact tracing, and infection control. This simply could not have happened had they not embraced mobile phones, the power of digital data, and state-of-the-art digital technology. The major point of my presentation is that there is a clear path out of today's TB crisis. Integrate and scale what TB showed to be possible in 2019 using the digital mindset of the COVID response. COVID has shown us the impact of patient empowerment, that people can and will self-test. TB programs must double down on trends and technologies for patient empowerment, remote patient monitoring, and delivering care to patients' home. TB must be better integrated into mobile phone apps used by primary healthcare workers so that all providers consider TB when treating chronic cough, perform the right evaluations, and perhaps we can achieve the holy grail of integrating TB screening and case finding into primary healthcare. Public health dashboards that have been developed for COVID should be expanded to include event-generated TB data, such as that coming from AI-enabled chest X-ray machines and connected diagnostic instruments. And in the process, we can break down the silos that have plagued public health. With integrated digital health records, community health workers would no longer need to make separate visits for vaccination, prenatal care, and TB case management. By embracing digital technology, TB care and control would also hitch its wagon to the exponential engine of global innovation. I want to take a minute to talk about one of them, the untapped potential of ambient sound to help us understand, diagnose, treat, and monitor health conditions. The ubiquity of smartphones is spawning a new field, acoustic epidemiology, which is the use of sound to monitor and track diseases. I am personally super excited by this. After a career as an academic and philanthropic funder, I recently left the public sector to join Hyfe, a small startup whose ambition is nothing short of changing the way the world manages cough. The current approach to cough is rather pathetic. It's critical in finding the treating TB patients, and yet we don't actually measure cough. Together with the Gates Foundation and Global Health Labs, Hyfe has created an app that anyone with a smartphone anywhere in the world can download and use for free. This app essentially turns a phone into a Fitbit for cough that allows patients to passively and unobtrusively monitor their cough while preserving their privacy. I think this technology will help individuals know if their TB is resolving with treatment and promptly recognize if their treatment is failing. Several multinational research teams are working to develop a Shazam for cough that might even help diagnose TB based just on the sound of the cough. Is that possible? Well, I don't know. But if it is, imagine a world in which anyone with a phone can diagnose their own TB. Hyfe is not alone in the vision that mobile phones will become the workhorse for global health. And our cough app is just one example of thousands of digital technologies that are being developed that have the potential to help solve the TB problem. The path is not without barriers that the G20 are uniquely suited to address. A recent study done by Stop TB and the Global Fund showed that countries have an ambition to go global and digital, but many will require significant technical and financial support. I'll end with a simple ask based on my premise that in order to bend the epidemic curve downward, we need to bend the innovation curve upward. I think this message is so simple that I had my daughter write it out. I asked this group to call on the G20 to bring the sense of urgency and the focus on data and digital technology that they demonstrated during the COVID response to other global health threats, starting with TB. Failing to do so will perpetuate the chaotic and inefficient propagation of unimpactful technology and ultimately cost billions of dollars and millions of avertible deaths. Whereas, with leadership and strategic funding from the G20, we can pivot tuberculosis from crisis to exponential progress. Thank you.